Osteoporosis by Jill Langer. Osteoporosis has gained recognition as a significant health problem in the United States, especially with the advancing age of the baby boomers. Osteoporosis is a disease that is characterized by low bone mass, deterioration of bone tissue, and disruption of bone microarchitecture, which can lead to compromised bone strength and an increase in the risk of fractures. And here are some statistics on osteoporosis. It is the most common skeletal disorder and is a major health problem that affects approximately 10 million Americans. The aging U.S. population is predicted to contribute to as much as a 50% increase in the prevalence of osteoporosis by 2025. And lastly, approximately 20 million postmenopausal women are thought to have osteoporosis and low bone mass. Combined, this results in an estimated 1.5 million osteoporotic fractures every year, including over 300,000 hip fractures. So how can we, as family nurse practitioners, help with the osteoporosis epidemic? Diagnosis and treatment for women suffering from osteoporosis is vital. The impact of fracture on a person's quality of life is dramatic. Awareness of bone health and nutrition should begin early in life before achieving peak bone mass. As advocates of women's health, nurse practitioners need to be diligent to educate patients about the disease and make appropriate recommendations. We as family nurse practitioners have an opportunity to make a meaningful impact on the lives of patients beginning at an early age when we can prevent the late-stage occurrence of osteoporosis. The patient for this selected case study is an 80-year-old Caucasian female with several chronic health conditions. She is a retired seamstress and is now widowed and lives with her grown daughter and her family. They live in a 2-story home that is not ideal for our patient. There are several outdoor steps at the entry, and there's only a full bath that's located on the 2nd floor, while the patient lives on the 1st floor. The patient is having some depression related to the recent death of her husband of nearly 55 years, and she's feeling a little depressed about having to lean on her daughter and son-in-law more. She tries to exercise when someone is around to help her, but typically she spends most days watching television and drinking coffee. She is continuing to feel increased back, rib, and shoulder pain, for which it's hard to her to find relief, and she worries that she's losing height. The patient has a primary diagnosis of osteoporosis. In addition, she has diabetes, hypertension, hyperlipidemia, and coronary artery disease. She had a fall 3 months ago and sustained a fracture to her 4th metacarpal. She is concerned about future falls. She is up to date on all her immunizations and health maintenance. The patient is on 13 different medications to treat her conditions, making polypharmacy a real concern. The patient has no known drug allergies. She is currently taking Fosamax 10 milligrams daily for treatment of osteoporosis. In the patient's review of systems, there are several areas of concern. The patient states that she feels like she has lost height. She describes mild neck pain and stiffness. She describes having a decreased appetite. She has never taken hormone replacement after going through menopause. The patient also complains of generalized fatigue and malaise. She reports increased back, rib, and shoulder pain. She describes the intensity as moderate to severe, and only rest and analgesics will alleviate the pain. The pain is dull and aching in nature. Typical presentation of a patient with osteoporosis would be advancing age, loss of height, kyphosis, history of a fracture, oral bone loss, restrictive respiratory problems, vertebral fractures, tenderness to palpation over spinous processes, and abnormal T-scores. Because osteoporosis is usually a silent disease, There are not typically common complaints. Typically, a first sign will be that a fracture occurs. The patient might also complain of loss of height. Recent fractures in any area should warrant further evaluation. In looking at the objective data, the patient's BMI is 21.2, which is low. The patient also has some tenderness in her shoulder area and limited range of motion. She also has tenderness located over the spinous processes. In looking at her laboratory data, you can see that her TSH is in a normal range. In looking at her DEXA scores, you can see that every score is abnormal, indicating that osteoporosis is present. There are numerous screening tools used in the geriatric population. 4 tools that I selected that would be beneficial for my patient include the Tenetti's Fall Efficacy Scale. This is a 10-item scale that assesses the patient's ability to do several different tasks and how safe they feel, or if they have an increased fear of falling. The second is the Geriatric Depression Scale. This is a tool that assesses depressive symptoms and screens for depression among older people. Third is the CATS ADLs. This is a tool to assess function and detect problems in performing activities of daily living. And last is the Frailty Index for Elders, which assesses for frailty risk in older adults. All these tools will be very beneficial to make a plan moving forward for my patient. The National Osteoporosis Foundation recommends that a person have a bone density test if you are a woman age 65 or older, a man age 70 or older, if you have broken a bone after age 50, if you are a woman of menopausal age with risk factors, you are a postmenopausal woman under age 65 with risk factors, you are a man age 50 to 69 with risk factors. It is important as nurse practitioners to do a thorough evaluation and assessment. The following laboratory studies will be important to rule out other causes of fractures. Hyperparathyroid issues, thyroid dysfunction, rare cancers are all things that need to be ruled out. Once a diagnosis has been made, treatment is multifactorial. First, a patient will need an adequate intake of calcium and vitamin D. Weight-bearing exercise is also suggested. Patients should eliminate tobacco, excess alcohol, and caffeine. Pharmacological treatment is also recommended for those with T-scores of negative 2.5 or less and a high 10-year risk of fracture. Our patient is on Fosamax 10 milligrams daily. It helps to treat and prevent further osteoporosis. It is known as a bisphosphonate derivative. As discussed throughout this presentation, the patient fits the clinical picture for osteoporosis. She is Caucasian. She is older at age 80. She has a reduced weight for her height with a BMI of 21. She is postmenopausal. She has a history of falls and a fracture. She admits to drinking a lot of caffeine daily. She has a history of diabetes, a sedentary lifestyle, and abnormal T-scores. This patient will need an interdisciplinary approach to making sure that all her needs are met. First, she will need a home safety evaluation for potential modifications. She probably needs a ramp to her front door and also assessment of a full bathroom on the floor with which she was living. She also needs a home health evaluation to assess her medication adherence and how well she is performing her ADLs. A dietitian or nutrition assessment would be indicated with her history of diabetes and needing to make some modifications for her osteoporosis diagnosis. Physical therapy for evaluation and plan with increased weight-bearing exercise to preserve her strength is recommended. She also may need evaluation for assistive devices, such as a cane. And lastly, the patient could benefit from some support groups, maybe group exercise or participating in a senior center for increased socialization. In conclusion, this patient has several chronic conditions, making her situation more complex. However, she has family support, access to care, and a desire to continue for better health. The main goal is to prevent future fractures, injuries, and falls. Ethical issues may arise if the patient begins to require more care than the family can provide, or if certain home accommodations cannot be made. Discussions with the patient about assisted living and end of life should be proactively addressed. Osteoporosis can drastically impact the quality of a patient's life. Early intervention can reduce the occurrence and complications. Patients living with osteoporosis need comprehensive care from an interdisciplinary team to fully meet their needs.